I now would like to recognize someone who, there's no one with greater passion for America's veterans who've been exposed to burn pits. Stands alongside Representative Slotkin, my good friend and neighbor, Dr. Ruiz. You're recognized for 3 minutes to comment on your bill.
Thank you, Chairman Takano, for your work and leadership on toxic exposures. Look, veterans are dying as delayed casualties of war or suffering from permanent disabilities from their exposures to carcinogens and other toxic chemicals emitted from burn pits used by the military. This is a Department of Defense self-inflicted wound. As an emergency physician and public health expert, I understand the science and urgency to act and save our veterans' lives. That is why I recently reintroduced with Republican Representative Fitzpatrick and Senators Gillibrand and Rubio the bipartisan, bicameral HR 2372, the Presumptive Benefits for Warfighters Exposed to Burn Pits and Other Toxins Act of 2021 to get our veterans the care they need and deserve. Under current law, a veteran who has an illness or disability must establish a direct service connection in order to be eligible for VA benefits. That means that after serving and sacrificing for our nation, veterans exposed to burn pits face a cumbersome and in many cases impossible burden of proof to provide enough evidence to establish a direct service connection between their health and exposure. We can and must do better. And my bill offers the most comprehensive coverage for our veterans by removing the burden of proof from the veteran. To receive presumption of service connection, a veteran would only need to submit documentation that they received a medal associated with the global war on terror or the Gulf War, and that they suffer from a qualifying health condition. Additionally, my bill would grant a veteran health care for burn pit exposure ailments and for other toxic exposures, disability compensation, and death benefits to a spouse or dependents. This is the most aggressive and comprehensive legislative initiative aimed at tackling the immediate healthcare crisis that too many of our veterans are facing. I first learned of the effects of burn pits when one of my constituents, Jennifer Kepner, 39-year-old Air Force veteran with a healthy lifestyle, no other risk factors, came to my office for help. She was battling pancreatic cancer with her oncologist, determined was likely linked to exposure to burn pits. I sat with her in her home as she told her story, and I can tell you that was one of the most impactful kitchen table conversations I've ever had. She spent her last month as a leading voice for her fellow veterans exposed to burn pits, which she called the Agent Orange of our generation. I was at her bedside with her husband and 2 children when she died on October 18, 2017. Her story continues to be an inspiration in this fight to protect veterans and their families from the pain and suffering she experienced, both from burn pits and from her difficult experiencing navigating the VA. As an emergency physician, I can tell you that in science and medicine, we know that if you have a high enough suspicion of an agent that causes a severe enough consequence, then you need to act on that suspicion. We have, according to the literature and science, enough suspicion, and veterans are dying. Therefore, we need to act, this Congress, to provide the relief, the care that our veterans need. With that, I thank you, and I yield back my time. I want to take this down to the basics. My first question is to Mr. Burke. Mr. Burke, would you consistently burn trash, including plastics, human waste, possibly even jet fuel, in your backyard or near your family?
I would not, sir.
Thank you. Dr. Kelsey, doctor to doctor, what potential illnesses could a healthy person develop if they consistently burn trash, as I mentioned, in their backyard?
Dr. Ruiz, that's a complicated question, but there's a panel.
It's not very complicated. You know the answer.
People will get.
What are the illnesses that can potentially be, they can develop from breathing in the smoke from burning trash in their backyard?
Well, it depends on the exposure. Certainly, respiratory illness is commonly encountered by inhalation of things that burn.
Right. What else? What other? So respiratory illnesses. What else?
Depending upon what you're burning, you can get systemic illness of all sorts. There's immunotoxic agents that you can inhale. There's you can have digestive ailments.
How about carcinogens?
Of course, absolutely.
Okay, so then asthma, constrictive bronchiolitis, COPD, potential leukemias, pancreatic cancer, brain cancers, all these are potential health consequences of burning trash in your backyard. And with the exposures and dosage, of course, Dr. Kelsey, that you had mentioned. So burning household waste produces many toxic chemicals and is one of the largest known sources of dioxins in the nation. Dioxin is a carcinogen. A carcinogen causes cancer. Cancer causes deaths, right? It's a pretty straightforward association. In fact, according to the EPA, burning waste is a serious public health threat. The EPA banned it in the US in 1979. It is bad for people here. It is bad for our military personnel serving our countries overseas. We need to end the exposure to burn pits in our military, and we need to act now to care for our veterans who are coming back with delayed injuries in the form of asthma, constrictive bronchiolitis, COPD, and cancers. Too many have been told by the VA that their injuries are not service-related, even though there is enough suspicion, enough evidence to show a high enough association correlation of the illness due to exposure to toxic chemicals from burn pits. We cannot sit by and watch our veterans wait decades like they were forced to with Agent Orange, which is why I will not stop fighting. We should not stop fighting until our veterans get presumption of service connection for their exposure to toxic substances during their service. Look, you have mentioned, Dr. Kelsey, that producing causality of an agent to an illness is very tough standards. Of course, they're tough standards. The best ideal way of benchmark research is to put a person and expose them to the agent, right? And then you can control the amount of dose that they get. Well, that's illegal because it's unethical. And you said it yourself that it is almost impossible to determine. So let's not use that as the strict criteria. We need to expand our models of association and correlation to show a high enough suspicion of an agent that causes a severe enough consequence, which is death. We have already correlation studies from firefighters exposed to the toxic smoke of jet fuels crashing into the buildings that caused cancers and respiratory illnesses. We already have dioxin that has been found in the sample and the sand in places where burn pits were used. And we have bronchoscopic biopsy samples that show metals in the lungs of veterans exposed to burn pits. So there is evidence to show a high enough suspicion, association, correlation to know that our burn pits exposed veterans are dying of cancers, being permanently disabled of respiratory illnesses. This question, last question, is for Mr. Burke. Does the VA support establishing presumption of service connections to veterans exposed to burn pits or other toxic substances?
Sir, as contained in the written testimony, my oral statement, the Secretary is committing to doing an end-to-end review of the current process.
All right, so then it sounds like we're going to have to do it for you. It sounds like this committee is going to have to write the legislation and do it for you, because we can't wait for a repeat VA performance the way they did for the veterans exposed to Agent Orange. We will not allow that to happen to our veterans in this generation. I yield back my time. I represent the eastern part of Riverside County in Southern California, which has a large veteran population. I think is in the top 11th county with most veterans in the nation. And as an emergency medicine physician, helping ensure veterans have access to high quality care is one of my highest priorities since the get-go. That includes making sure that our veterans who are exposed to harmful toxins during their service to our country get the critical health care needed for their war illnesses. This is why Senator Gillibrand and I reintroduced the Presumptive Benefits for War Fighters Exposed to Burn Pits and Other Toxic Exposures Act of 2021, along with our Republican colleagues, Senator Rubio and Congressman Fitzpatrick. We cannot simply pay lip service to our war heroes and thank them for their service. We owe them the health care and benefits that they earned when we sent them to war for our country. Anything less than presumption of service connection for toxic exposures is not acceptable. Let me repeat that. Anything less than presumption of service connection for toxic exposures is not acceptable. Mr. Hoare, you're from the Iraq, Afghanistan Veterans of America. Can you articulate the importance of the establishment of presumption of service connection for veterans exposed to burn pits and other toxic exposures?
Yes, thank you very much, Congressman, for working so closely at reintroducing the Presumptive, the Warfighters Act is one of IAVA's top priorities to ensure. I want to echo your statement that anything less than a presumptive of illness is not acceptable for IAVA. The presumptive of illness would open up so much for veterans that are currently sick or is sick in the future. Proving the illness, as I mentioned before, can be extremely difficult because of the time that has lapsed or lacking DoD records that would take that burden of proof off of the veteran. And they no longer have to wait for all of these research studies to be done, which may never link 100% because of all of the issues with the research that our previous panel had mentioned that we've had in the past, that we've run into before. Additionally, it will encourage veterans to come forward with their claim as VA wants because they know they don't have to go through this bureaucratic red tape to prove all of these different things, that they were exposed, that they are sick, et cetera, et cetera. So we believe all of these reasons are why a presumptive illness is so important.
Thank you, Ms. Keenan. Do you think that it is premature, as mentioned previously, for the VA to support toxic exposure legislation?
Thank you, Congressman, for that question. We absolutely do not think it's premature. We are actually disappointed that VA hasn't taken the opportunity in this and last week's hearing to express their feelings about these bills. We'd like to work together with them to come up with a solution. But to be honest, the train has left the station. We really believe that comprehensive toxic exposure legislation can and will pass this Congress, and we're going to continue to advocate for that.
How can the VA be more transparent with implementing its framework for responding to veterans exposed to toxic exposures? Mrs. Keenan? Again,
we don't want to wait, for VA to try to come up with yet another plan and then, find the statistics and find out to see if it's effective or not. We really think that legislation has worked in the past and it will work in the future.
Thank you. Ms. Keenan, as you know, I've co-founded the Bipartisan Burn Pits Caucus. And for many years, I've laid out a framework, a public health scientific approach to the issue of burn pits. There's 4 pillars to that framework that I've been speaking for so many years. One is to end the exposures to the burn pits, to the agent that's causing harm. 2 is aggressively educate through outreach to service members and veterans exposed to toxins and trained providers and personnel in DoD and VA and the general public. 3 is take care of our patients, provide the health care and the benefits to our veterans. And 4, do the research to understand the full gamut of illnesses caused by hundreds of chemicals that our veterans have been exposed to. So those are 4 pillars and approaches of a framework that I've been speaking about for many, many years. And if we take those as pillars as a committee, then we will ensure that we address this issue once and for all. With that, I yield back my time.